In this video, I want to help you see cancer differently, not with fear, but with understanding. Because when we understand the tumor microenvironment, we gain the power to influence it. You've probably been told that cancer is the enemy, that it must be attacked, destroyed, or eradicated at all costs. But what if the real problem isn't the cancer itself, but what if it's the environment that allowed it to grow in the first place? In this video, I want to help you see cancer differently, not with fear, but with understanding. Because when we understand the tumor microenvironment, we gain the power to influence it, and that can transform the course of healing. Hi, I'm Dr. Fred Bloom, a holistic and integrative physician in Kensington, Maryland. For over 3 decades, I've helped patients with chronic illnesses and cancer take back control of their health by addressing what I call the terrain, the biological environment that determines whether cells express health or disease. If you find this kind of content valuable, insights that bridge conventional medicine with integrative, regenerative healing, I invite you to subscribe and also join my newsletter for more in-depth education, case studies, and patient success stories. You'll find the link below. Let's start with a difficult truth. Cancer doesn't happen overnight. It's not a random lightning strike. It's the result of chronic long-term imbalances inside the body. Think of your body as a garden. Healthy soil grows healthy plants. But if the soil becomes depleted, acidic, or full of toxins, weeds begin to thrive. Cancer is that weed. If we only focus on cutting or burning the weed, we miss the deeper question. Why did it grow so well in that soil? That soil, the tumor microenvironment, includes inflammation, immune signaling, oxygen levels, blood flow, acidity, and even emotional and energetic states. All of these factors influence whether your cells stay cooperative and healthy or go rogue. Let's get a bit scientific, but I'll keep it simple. Every cancer cell lives in a tiny neighborhood of cells, blood vessels, and immune messengers. This neighborhood is what we call the microenvironment. When that environment is low in oxygen, cancer cells switch to inefficient sugar-burning metabolism called glycolysis. Inflamed, the immune system becomes confused. Some immune cells fight the tumor, while others accidentally protect it. Acidic, normal cells weaken, and cancer cells thrive. Nutrient depleted, the surrounding tissues can't regenerate. So while most therapies aim to kill cancer cells, integrative medicine also focuses on changing the neighborhood they live in. That's where true healing begins. When you restore oxygenation, calm inflammation, and improve circulation, cancer cells lose their advantage and your healthy cells regain control. How does this toxic terrain develop in the first place? It's rarely one single cause. Usually it's years, even decades of small insults that accumulate. Chronic infections or mold exposure create silent inflammation. Stress hormones like cortisol shut down immune surveillance. Environmental toxins, pesticides, heavy metals, plastics burden detox pathways. A high sugar diet fuels metabolic chaos and acidifies tissues. Sleep deprivation and emotional trauma further suppress immunity. Each of these chips away at the body's ability to regulate itself. Over time, a healthy, oxygen-rich environment becomes stagnant and inflamed. That's when cellular mutations start to thrive. This is where integrative oncology makes such a difference. Instead of focusing only on destroying tumor cells, we support the entire system so that it stops producing disease conditions in the first place. We can do this through multiple strategies. Oxygenation therapies, ozone, hyperbaric oxygen, and intravenous vitamin C increase oxygen tension, making the environment less favorable for tumor growth. Detoxification, chelation, sauna, lymphatic drainage, and gentle liver support reduce toxin load and inflammation. Immune modulation, mistletoe therapy, photodynamic therapy, and specific peptides help the immune system recognize cancer cells again. Hormone and metabolic balance, stabilizing insulin, cortisol, and thyroid hormones prevents the biochemical chaos that feeds tumors. Emotional and spiritual healing, because trauma, fear, and unresolved stress also create inflammation and weaken the immune system. These are not alternative ideas. They are complementary approaches that enhance the effectiveness of conventional treatment while improving quality of life. I once worked with a patient who had recurrent breast cancer after traditional treatment. She came to me exhausted and fearful, not ready to give up, but not sure what else to do. We started by rebuilding her foundation: oxygenation, mitochondrial support, hormone balance, and gentle detoxification. Over months, her fatigue improved, her sleep deepened, her anxiety quieted. Her follow-up scans showed something remarkable. The environment around her tumor had changed: lower inflammation, improved blood flow, stronger immune response. That's what real integrative care does. It doesn't just attack the problem, it transforms the terrain. After a cancer diagnosis, the goal should be more than survival. It should be reconstruction, rebuilding a physiology that resists future disease. That means nourishing mitochondria, restoring muscle, balancing hormones, and reprogramming the immune system to stay vigilant. When patients focus on this, they not only stay in remission, they often feel better than they did before diagnosis, because what they're really healing is not just cancer, but the internal environment that allowed it to exist. If this message resonates with you, if you want to understand your health in a way that connects science, nature, and meaning, then I invite you to stay connected. Subscribe to this channel, and more importantly, join my newsletter for deeper insights, patient stories, and educational updates on integrative medicine, cancer recovery, and regenerative therapies. It's where I share things I can't always fit into a video: protocols, mindset tools, and the latest medical research that bridges hope and evidence. You'll find the link in the description below. I'm Dr. Fred Blum. Remember, health isn't just the absence of disease, it's the restoration of balance in mind, body, and spirit. Thank you for watching, and I'll see you in the next video.